Hello, everyone, and welcome back to Wellness Wednesdays. So, this week we're taking a little bit of a different approach and we're going podcast style. So, let us know what you think in the comments, and we hope you enjoyed today's episode. We have Dr. Mark Hamra with us, who is going to be discussing all things blood pressure. It is Blood Pressure Awareness Month, so we wanted to cover this topic and thought Dr. Hamra would be a great person to kind of introduce us to blood pressure and some of the questions we might have surrounding it. So, Dr. Hammer, would you like to tell us a little bit about yourself before we dive into the questions?
Sure. Hi, Jenna. Thank you for having me. So I'm a board certified family medicine physician, been in practice for over 20 years, prior Air Force, and I have a side interest in integrative medicine, which is prevention and doing things to treat conditions that don't really involve using only medications.
That's awesome. Yeah, and that kind of goes into some of the questions we have today with, how you can prevent from having high blood pressure even without medications, or if you get it, what can you do without it? But we'll dive into those questions a little bit later. Okay, so we'll go ahead and get started. First question is, what is high blood pressure?
Okay, so it's a condition where your vessels either are starting to harden, so they aren't as elastic as they should be, or some other conditions are hereditary, where your kidneys maybe aren't working as well as they should. These things cause the arterial blood pressure in your body to be elevated. And what that means is there's two numbers. One's called systolic, an upper number, diastolic, a lower number. And when your body's not responding properly as far as the relaxation of the blood vessels, those numbers will go up. And typical normal numbers, what we like to see is less than 120 on the upper number, less than 80 on the lower number. Basically, if you get over 130 on the upper number and over 85 on the lower number, you can be diagnosed with hypertension. But a really healthy blood pressure is below 120, below 80.
Mm-hmm. Okay. And is there ever a time when the upper number will be really high and the lower number will still be low, or do they work together?
It's a great question. There are conditions in the body like right heart failure or other kinds of liver disease can cause it, congestion of the liver, where you have what's called a widening pulse pressure. And so the pulse pressure is the difference between the systolic and the diastolic. And they typically, in most normal hypertension, we're talking about hypertension, high blood pressure this week. They typically go up and down together.
Okay, interesting. All right, yeah, well, that was good to know. So speaking of you said a little bit of genetics. What is kind of the most common reason for high blood pressure that you see when you're working with your patients? So just on a daily basis, or just from statistics and research that you've seen?
We live in America. I'll give you a guess what number one cause of hypertension is.
Diet and exercise, so lifestyle.
Obesity.
Yeah.
So, yep, being overweight is what probably a number one cause. You find most tobacco users develop hypertension.
Was that a cat?
Yeah, that was the cats. They're fighting.
They'll lower blood pressure sometimes.
Yep. We'll get to that. Yeah. Oh, yeah. So, tobacco use, almost everyone who uses tobacco ends up developing hypertension, being overweight. Some people, and there's controversy over this. So, you take it with a grain of salt, I'll say. Salt use, it can in some genetically predisposed folks cause hypertension. So reducing your salt, can kind of lower your blood pressure in some people, but it doesn't in others. And like I said, the dietary folks want to tell everyone to lower their salt intake, and that's probably not a bad thing, but won't always help your blood pressure.
I feel like if you're cooking at home a lot, you don't really have as much of an issue with your salt intake as if maybe you're eating out a lot. So maybe that could be something people focus on.
Well, I think the key word there is cooking and not just heating stuff up. If you're grabbing a thing out of the freezer section and throwing it in a microwave, you might want to read those ingredients. They tend to have a lot of sodium in them. But cooking for yourself and not eating things that are canned or preserved. That's a good way to improve your overall health, and it will bring your blood pressure down.
Okay, awesome. And then going into genetics a little bit more. So a lot of people say Like that's the main reason for someone having high blood pressure. And you said basically lifestyle is that reason, but how does genetics play a role in someone having high blood pressure?
So it's not really clear on what, we're doing a lot of genetic learning these days with the DNA programs that are out there, but it's not really clear, but it is definitely genetic as well. You're genetically predisposed to getting hypertension when exposed to certain environmental factors. So it's kind of not a simple answer, like just being obese. We kind of know obesity and tobacco do what no, regardless of your genetics, they can lead to hypertension. But you could be relatively fit and active and thin with low body fat and still develop hypertension. Um, and the factors that cause that are mostly around the electrolytes in the body, the sodium, potassium, chloride, CO2, these things, but it's unclear exactly what the mechanisms are. It involves the renal system, your kidneys, and your a couple of pathways in the body that people, well, we're all unique and they're different. And so if you have a lot of people if you have healthy people in your family that have high blood pressure, you need to get yours checked frequently.
Okay. Yeah, that was the next question is how often should somebody get their blood pressure checked if it does run in the family?
Depending on your risk factors, the best place to get it checked is at an annual doctor's visit or whenever you're, near a doctor's office, getting your blood drawn. Sometimes you can do it. There are machines in Walgreens and Walmart and CVS, places like that. You can't always rely on the fact that they've been calibrated properly. So it's not 100% reliable, but something's better than nothing. But I would say someone should check their blood pressure at least once a year to see if it's elevated. If they are towards the high side, they need to see a doctor and then get on a regular schedule of checking it, maybe even get very inexpensive home blood pressure monitors now. But the tricky part about doing it yourself is, and going to those machines, if the cuff size is not right, you're not going to get an accurate reading, even if it's calibrated. So,
Okay.
the best place is to get it done at your doctor. I think most people should have an annual visit.
Right. Okay. Yeah, that kind of leads into we have a preventative care initiative coming out sometime in June or July, just having people go to get their annual checkups and they're getting an incentive for it. But that could be a great time to go get your blood pressure checked.
It is things like that. Health fairs are awesome, but the thing to remember, and what I wanted in my mind to point out at the top, but we'll do it right now, is the tricky thing about high blood pressure is you don't get symptoms until you're already doing damage to your body. So by the time you get headaches or vision changes or bloody noses from your blood pressure being so high, you're probably up in the 180, 200s. And like I said, normal's below 120. You're have let it go too far. That's why, and since really everyone who has just starting to get high blood pressure is asymptomatic, they have no awareness of it. That's why you kind of have to put it on your schedule to just routinely check your blood pressure.
Okay. What are some of those other symptoms that people might have?
Oh, you can get chest pain, shortness of breath. Like most people get headaches, changes in vision, and nosebleeds are kind of the early symptoms. But the consequences of letting blood pressure go over the long haul is a markedly increased risk of heart attack, strokes, which are horrible things to have happen. You can start losing kidney function and end up on dialysis. I mean, there's just consequences to blood pressure that are so avoidable. Easy to treat with many different medications and the trick is everybody reacts differently to medications, but if you do have high blood pressure and the doctor gives you medication and you don't like it, you have a side effect, you go off of it and you get on a different blood pressure medication. And I've never had a patient I couldn't find a good medicine for them that they didn't have any side effects and it helped their blood pressure.
So it's not about, if the medication doesn't work, it's telling your doctor and making sure you get on a different one because there probably is going to be one for someone out there.
Exactly.
And then leading into that, so what are some ways people can treat high blood pressure along with medication if they're already taking it, or making sure that they don't end up getting high blood pressure? Even when they have high blood pressure, how can they change their lifestyle? Because I know it's all kind of similar.
Well, being active, first of all, is a good start if you have an inactive lifestyle. If you drink more than 2 alcoholic drinks a day, your blood pressure is going to be high. You can reduce that alcohol intake. Your blood pressure will come down.
Mhm.
So salt intake, if you happen to be in that category, reducing, you won't know until you try. So reducing salt intake is a good idea. One thing that people don't really know is you need to make sure that your potassium and calcium, magnesium are all in balance and that you have enough of those in your diet. Magnesium rich foods, leafy green vegetables, you know, potassium, things like spinach has a lot of
Mhm.
potassium. Bananas have
Avocados, bananas.
avocados, bananas, but bananas are so starchy. It's hard to recommend people eat those frequently. Uh,
Okay.
but you know, something like Mrs. Dash's no salt,
Mhm.
sprinkling that on your salad, and using less dressing, then it has plenty of flavor. There's a lot of potassium in there, and that can get your potassium up. There are magnesium supplements you can take if you don't feel you get enough magnesium, things like that. But researching some foods that have, the calcium, magnesium, potassium, keeping those in your diet will lower your blood pressure.
Okay. And you can get all of those tested at the doctor to see kind of what your starting levels are and then
Pretty
go from there.
routine. Yep, those are electrolytes I talked about.
Okay. Nice. What is a tip that you have or that you've seen or given patients that people adhere to? I know everyone's different, but is there kind of a universal way or tip you've given people to help them change their lifestyles if you see that's something they need to do?
So the key I think is moderation on things. All things in moderation except moderation, right? The other thing that I would add that skipped my mind is stress clearly can affect your blood pressure.
Hmm.
So biofeedback mechanisms, meditation, prayer, just taking some time to be quiet and allow your body to reset. Those things will help your blood pressure greatly.
Okay.
And if people can get in a routine, they actually find they really enjoy a little quiet time, reading, praying, meditating, things like that.
Hmm. Okay. Awesome. All right. Well, on that note, do you have anything else to add before we wrap it up?
Well, I'm sure I forgot something, but I did my best. So that's where we'll leave it today.
Awesome. That sounds great. All right, everyone. Thank you for joining. Thank you, Dr. Hamra, for joining us as well and giving us a really informative session. Leave a comment in the box below. Please subscribe, like the channel, and we'll be sure to get you guys more information and more topics that you have been requesting.
Thanks
Thanks,
for
Dr.
having me.
Hamra.